Hi, thank you for downloading this Device Talks podcast. I'm Brian Johnson, publisher of MassDevice, and I'm pleased to have with me today NuVasive's CEO Greg Lucier. Greg, thank you for joining us. So, Greg, I read that you're another medtech guy that comes from GE. So, did you work under Jeff Immelt?
I did.
Okay.
I was with Jeff in the late 90s up until the year 2003 when I moved out here to San Diego.
So, I mean, one of the things that I always find fascinating about that is, I mean, the amount of CEOs that came out of his division. Is there any way to explain that?
It's an interesting phenomenon, but that company, GE, and that business of GE Medical, as it was called back then, in that era had some remarkable people in it. It was the glory days of that business for GE. We grew very rapidly, organically, and through acquisitions. And it spawned a lot of folks that went to a lot of corners of the healthcare industry.
Big corners.
Big corners.
I mean, we're talking Omar Ishrak from Medtronic, Mike Mahoney from Boston Scientific, yourself, obviously.
Yeah, a lot of them.
That's not even like the tip
Pete
of the
Arduini
iceberg.
runs Integra Life Sciences.
Right.
I mean, you can just go on and on, all those people that were there at that time.
So I read that when you went to Life Technologies, you tried to incorporate that culture there, and that it didn't quite work out.
Well, we in GE had that Darwinian philosophy of
Right.
removing the bottom 10 or 20% at the time. And you know, I had spent my career at GE, so that's all I knew, and so that's the practice I deployed at Vitro Gene, the predecessor company of LifeTech. And I'd say it was probably a little harsh for a science collaborative-based culture, and so we had to correct our approach after about a year and a half.
I wonder what lessons that you still take from your time at GE.
You know, GE, I think, taught us a lot of great fundamental aspects of running a business that are true to this day. You know, one of the ones that I just always hold dear is face reality. Yeah. You know, don't in any way look through rose-colored glasses of how the world is, but better understand just how it really is, and then you'll make better decisions. And you should do that with people as well.
Well, how does that jibe with your theory of irrational leadership? I read about that in another article as well.
Well, I think they're absolutely two different things.
Okay.
So one is to understand the world, you know, as it is, right? But the second is then your role into that reality and how you should behave. And I think a leader, if they're going to be in a growth vector, has to be absolutely irrational about their expectations of how they want the future to be. And you know, anybody can be rational, anybody can do the 3 chess moves, but I think to have the imagination and then more so the will to demand that irrational expectation is some element of what a great CEO should embody.
Well, I mean, what other things should a great CEO embody, in your opinion?
Well, those are 2 of them.
Yeah.
And then I think the last one that you would want to throw into the triangle is the ability to operationally execute each and every day. Many times you'll see a great CEO that's a great strategist, but not a great operator, or vice versa. And so to the extent the person can be 360 in all of that, then I think they can be pretty darn effective. So
you came over to NuVasive after some extraordinary success at Vitro Gene and Life Technologies. I wonder what attracted you to the opportunity at NuVasive?
Well, I was on the board of directors at NuVasive, and we had to make some changes there at the company. And the board just said, well, geez, Greg, you've been a chairman and CEO, why don't you do the job? And I did it.
You did it as an interim, and you took the job full time. I imagine that there was something that was...
You know, for me, Brian, I saw just a young company that had enormous potential. Reminded me very much of Vitro Gene back in the day. It was a category-focused, category-killer company taking share from everybody. And I thought it could be a lot of fun to be part of this team and part of a future they were building. And I haven't been disappointed. It has just been a lot of fun painting the world purple, as we say.
Yeah. What can we derive from your tenure at Life Technologies and how you grew the company? I mean, you grew it exponentially. You grew through aggressively through M&A. I mean, does that opportunity exist at NuVasive in the same way, or is it going to be a different playbook you're going to be using?
It's a different playbook here. So the opportunity to acquire companies at Vitro Gene was absolutely abundantly clear. Just no one else other than our company and Fisher Scientific back in the day were doing it.
Right.
The economies of scale by consolidating around a sales force, around a manufacturing plant were absolutely calculable and quantifiable in terms of the bottom line. NuVasive has a different opportunity. It's probably even better. And that is that we're growing organically fast because our products are demonstrably better, and so share is being given up by the bigger, older entities and being given to NuVasive. And once you get on that flywheel of share taking, it builds confidence, and then the actual results get better and better.
Yeah.
So for us, it's actually an organic growth story with a little bit of acquisition sprinkled in.
Do you think you can grow it to the same footprint that you grew Life Technologies? And that was, I think, 12,000 employees or something like that.
I think we can make this company a lot bigger than it is today.
Right. The opportunity at Life Technologies is such a transformative space. I wonder, do you find that the opportunity excitement level is the same in an orthopedic space as it was in where you were?
Well, this would be the experience to me unto myself, but the second time around is different.
Yeah.
And in some ways it's not as good, in other ways it's better.
Yeah.
I've seen all the problems before, so I don't get flustered by them.
Right.
But with that kind of lack of newness coming to me comes the wisdom of I can make these decisions better than I probably would have done in the past.
I mean, are there mistakes you're determined not to make this time?
Yeah, but I'll make them again. No doubt about it.
Care to share any of those?
Not yet.
I read that when you were in grad school at Harvard Business School, you asked yourself what transformational factor would impact the 21st century, and that's how you came to life sciences. Did you ask yourself a similar broad life question after you were done at Life Technologies? Did you say it now? I mean, I wonder what you said when you were done with that challenge. What'd you ask yourself?
Well, what I did when we finished the deal with Life Technologies in terms of its merger with Thermo Fisher, and I stepped down, I took a portion of my money and invested it in very interesting companies that I saw could be part of that future. I invested in a company, and I'm on the chairman of the board of Epic Sciences that's doing circulating tumor cell technology. I invested in a spin-out from Qualcomm called Gimbal that's doing proximity sensing for mobile advertising. And so I did a number of those investments where I'm still actively engaged because I wanted to continue to participate in that future envelope that needs to get pushed.
Right. And yet you're back now running a publicly traded medical device company.
So we just got to make it all work.
Obviously, life sciences, I mean, this is an area you feel really passionate about. You said in 2009 that one of your fears was that we won't realize the full potential of the life sciences industry. We're 6 years past those remarks. Do you still worry that we're not tapping into all the full potential that we have in the life science space?
What drove me to make those comments back then was the fear that genomics and genetics could ultimately fall to the wayside like the nuclear power industry did. I mean, we can say what we want about nuclear power. It's cheap, it's green, and it's perpetual.
Yeah.
And yet we know what has happened to that industry. And with genetics, it has the same promise, but if conveyed to the public the wrong way, it can never fully achieve that promise. And all you need to do is look at genetically modified crops today and kind of the bad mouthing that has taken place.
Right.
Incredibly unfortunate to the people who are starving in the world. And so that was the genesis of those comments back then. Now, cut forward a few years, we are in a renaissance period of cancer drugs, and they are all driven by our knowledge of genomics. And I think that's incredible, and I think with that proof statement, we hopefully are going to see genomics, genetics here to stay to positively change the world in which we live.
Right. Let's talk about outside of the life sciences space. I mean, you said that public service, politics, something that really interest you. Do you think eventually, when all this is done, you're gonna try your hand in that space?
I gave that a lot of thought after I stepped down from Life Technologies, and you can see the decision I made was to become a working stiff again. That said, I do have interest in public policy and potential government service. And I think actually the silver lining of what we see going on in the presidential election today, you can say what you want about Donald Trump and Carly Fiorina. I think it's incredibly positive, though, that ordinary citizens, not professional politicians, are now throwing their hat in the race.
Yeah.
Because I think if there's anything we can all agree on in this country today, is that we need more bang for the buck of what we spend at the government level. And I think a business-minded person could help with that in a really large extent.
How about, in terms of life science, medtech, do you think the elected officials understand what this industry needs to succeed?
Partially. You do worry that most members of Congress don't even carry a passport, don't have a college degree, and so you're a little mystified potentially that they do understand it all.
Yeah.
But look, the 21st century is one of the life sciences. Our existence and what we call humanity will be radically changed by our knowledge of life sciences. I remain adamantly convinced of that. I'm an investor in that, and you will see how our world changes radically over the next 25 years.
What spaces of the life science sector really excite you?
Look, we're going to solve cancer, just like we basically have solved cardiovascular disease in a large way. And I think that's the next decade plus that is going to see that type of innovation. I think we're going to see ever more minimally invasive surgeries by the medical device industry that radically transforms surgery. So I think that's another big emerging trend. And then lastly, where we talked about before, the ability to positively deploy genetics in the food, in testing, in all sorts of ways that we hadn't thought about before, I think is going to have great positive impact on our world.
In terms of solving cancer, are we talking about solving it in terms of curing it, or solving it in terms of making it a chronic disease that is manageable?
Chronic disease,
or
yeah. Look, I may have misspoken. It will become a chronic disease.
Right.
Not every cancer, because cancer is probably 10,000 different subtypes. But cancer broadly will be a manageable disease, much like HIV has become a manageable disease.
What macro factors do you think have to be in place for that to be achieved? Is it simply a will combined with capital, or are there other stakeholders that have to be involved?
Interesting question. I think that the innovation rate is at the right pace to get us there. Structurally, to your question, a lot of these therapies will be combination therapies where you'll own one and I'll own one, and we'll have to come together for it to be one.
Right.
And I think that world is just starting to unfold. So the level of cooperation in the industry has to start happening, but because there's the incentive of profit, it will happen.
Right. And one of the things that we always ask is, what didn't I ask that you wanted to answer?
Let me tell you about NuVasive. You are a device reporter. This is an incredible company.
Yeah.
It invented lateral back surgery. And look, who the heck wants back surgery, right?
Right.
The only time you go in for back surgery is when the pain finally reaches the point where you can't tolerate it anymore.
Right.
Think about a world, though, that changes to where there are literally millions of people who are living a life that's been greatly impaired because of pain, but they don't want to go into the surgery. Our mission at NuVasive is to touch those patients and turn back surgery, spine surgery, into something that's an outpatient procedure and utterly transformable in terms of their lives. Because you can't find me one other malady that literally will lead you to suicide like spine pain.
Right. I think I've interviewed Bill Walton. I know that his story, and he's obviously one of your spokespeople.
Right.
In terms of, the surgery is incredible.
It is incredible. 2 days, you're up and about, and you're going again, and your life is literally transformed from being one of absolute desperation to one of, he is in perpetual joy from here forward, right?
And, well, he is, yes.
Yes, he is, right?
And most of that,
and he'll tell you that.
Most of it can be attributed to his back surgery, of course.
Right.
But I think of the pain that he had to go to in order to find that surgery. What are the challenges for you to make sure that people are aware of that, or do you find that those patients seek you out?
We're still too hard to find, and spine surgery is too complex still to navigate the right decisions. We have a goal at NuVasive to address that, and we have a program called The Better Way Back that Bill is part of, but we've got to do much more of that consumer education to make people realize that it doesn't have to be that way.
Right.
They don't have to live with the pain. They can actually bring sunlight back into their lives.
And this is, they call it the X-lift procedure?
The X-lift procedure. It's a lateral procedure through the side that is minimally invasive, just small percutaneous holes, and you're literally up and about in 2 days, and you're completely rehabilitated within 6.
And these are people whose vertebrae have compressed to the point where they're...
All sorts of conditions in the spine. It could be misalignment, could be compressed discs, could be shattered discs, broken vertebrae. You know, the procedure itself is not limited to the malady you're fixing.
Right. And it's, you're literally putting the buffer zones back in between the,
Correct.
the vertebrae so that
in that case,
they can
have some space again, right?
And right now it's just it's primarily a spinal company. Are we going to stay in that space, you think?
It's a good question. You know, the core competency of the company is the ability to navigate nerves. So neurophysiology is something that the company invented in this space and allows us to do this lateral surgery and navigate the solus. But because of that knowledge, I think it can take us to other areas in the body ultimately in terms of minimally invasive surgery. The brain is something that, you know, could be in the horizon for us.
Interesting. So it's not really a turnaround scenario because it was already doing pretty well. So is this
transformation?
This is a growth and push forward.
You got it. This is the path to, first we're going to be the best in the world, then we're going to be first in the world.
Do you ever see it becoming a competitor on a global scale to a Stryker, Zimmer, Biomet kind of massive ortho company?
I don't think so. You know, the spine itself is a somewhere between $6 and $10 billion category. We can be a very profound company by being the biggest in spine. And then, as I said, probably moving into brain surgery beyond that, which, look, when you look at brain surgery, we're just getting going.
Yeah.
So, you know, that in and of itself will be far bigger than spine ultimately due to the complexity of it. So I think we got lots of runway just staying focused on maybe 2 areas like that.
In what aspect of brain surgery are we talking about?
You know, I would say that some of the aspects that we're looking at in terms of navigation and understanding how to navigate nerves and sensitive areas apply themselves to other parts of the body.
Wow.
Yeah.
So that is pretty fascinating.
Yeah.
I would say that that's almost as fascinating as what you were doing your prior.
Could be.
Could be.
Stay tuned.
I will. I mean, I wonder, I guess some people find the orthopedic world, I don't know, not that it's boring or passe, but it, you know, it doesn't have the same excitement that it had maybe 10 years ago.
I would agree. If you're doing hips and knees,
Yeah.
you know, to me that's a big snooze.
Yeah.
Our company, though, you know, spine is different. Here's why spine's different. Because it's about 50-50 between an orthopedist and a neurosurgeon. And when you have the neurosurgeon involved, it radically changes the complexion of the business.
Yeah.
So it has unique characteristics that I would argue don't throw it into the orthopedic bucket.
Okay. Is there anything about the spine that you didn't know going in? That,
I still don't know.
Is there one really fascinating thing you've learned that you
I'll
tell
you
people
something.
at cocktail parties now?
I'm going to tell you something right now. Did you know that all your genes to program your spine sit on chromosome 5, which is unusual, and literally the genes that are from our earlier ancestors, the Cro-Magnon and the like, still exist in chromosome 5 for some reason. They've been preserved, which is unusual. So there you go.
What can we find out from that besides it being
Well,
really
and
cool?
just I would say that the spine that we have now as Homo sapiens is actually requiring less genes than the one of a Cro-Magnon man.
Oh, wow.
So there's your little factoid for a cocktail party.
That is a good one.
Yeah.
I don't know where I'm going to...
Oh, you got to use it. I'd say somewhere between the second and third glass of wine.
Will do. Will do. Well, this has been really, really interesting. Thanks
Great.
so much for joining us, and best of luck at NuVasive.
Great. Brian, thank you very much.
Thank you, Greg. Bye-bye.